this video, I'm going to explain what treatment for birth trauma involves. Now, birth trauma is a problem that affects between 25 to 35% of women in the UK. It also affects men. And there are two treatments that are currently thought to be effective for birth trauma. They are cognitive behavioural therapy, or CBT, and eye movement desensitization reprogramming, or EMDR. So I'm going to talk you through each of these. Starting with CBT, there's kind of two parts to this treatment. The first part involves dealing with your thoughts. Now, when something traumatic happens, we have a tendency sometimes to think about it in a way that can stop us processing and readjusting to that experience. These types of thoughts include things like bad things happen to bad people. I can't cope with this, that means I'm defective. This is proof that the world isn't a safe or a fair place. Or I can't rely on other people, even those that are trained to help me. Now, what these thoughts do is they keep your mind very closely engaged with the experience, as if it's only just happened, or maybe as if it's still happening. What CBT does is it helps you to get hold of those thoughts and then assess their accuracy and their helpfulness and replace them with thoughts that will help you to process and readjust to the trauma. The second part of CBT involves the way that we tend to respond to traumatic events. Now, often we will avoid reminders of the experience because in the short term that makes us feel a little more comfortable. But in the longer term, it stops us thinking about what has happened, and we need to think about what has happened in order to process it, readjust and move forward. So what CBT does is it teaches you a set of skills or techniques that helps you to face those reminders in what feels like a manageable way, so you can start that process of readjustment and moving forward. Now, the number of sessions you need will very much depend on how complex your difficulties are, how much your symptoms are impacting on your day-to-day, but it will be somewhere between 5 and 15 sessions one-to-one with a therapist. Okay, moving on to EMDR. So in EMDR, the therapist will guide you to make rhythmic movements with your eyes whilst recalling the trauma. The idea here is that those eye movements stimulate the information processing parts of your brain that allow the experience to be processed and allow you to readjust to it. Similar to CBT, it kind of depends on your difficulties, how much you're struggling, but you will be offered somewhere between 5 to 15 sessions, again, one-to-one with a therapist. Okay, I hope this was helpful. Thank you for watching, and I will see you soon.